Hello everyone. Here I want to share the waveform formations of ECG. That's a very important and very fundamental portions in learning ECG. If we don't know the basic principle of ECG, we're not easy to move on advanced level of ECG, as well as we will not be able to interpret ECG easily, and it will be some difficulty to interpretations as well as to applying to our patients. Okay, so let's start with that. Here is the ECG waveforms: P wave, QRS, T wave. Also PR interval, QT interval, PR segment, SD segment, and QS complex. Why does it happen? Why there is P wave? Why there is QRS? Why there is T wave? And what does it mean? We all need to know that P represent what, QS represent what, and T represent what. Okay, so let me write down some words here. So we move to waveform of ECG. If we want to know why there is waveforms, we have to also know that there is electrical activity in the ECG. There's electrical activity in our cardiac muscles. Okay, so what is electrical activities? That means the action potentials of our cardiac muscle. So if there is action potentials, there will be electrical activities, and there will be waveform in our ECG. Okay, we will move on to very basic principle of the cardiac muscles. Okay, so here is your cardiac myocyte. If we cut some sections of myocardium from here, and then we optimize this, and you will get here that is your cardiac myocyte. Let's imagine that. Okay, that's a cardiac muscle source. Cardiac muscles, in other words, cardiac myocyte, right? Cardiac myocyte. In cardiac myocyte cells, if we move on to very basic level of sub-cellular level, there is some important PAM, like sodium potassium PAM, right? Sodium potassium PAM. Also, there is calcium PAM here. These cations are very important in the formations of cardiac muscle action potentials. Okay, let's see with this diagram. You all know that that's a very basic physiological part of the action potentials of cardiac muscles. Here, you can see phase 0, phase 1, phase 2, phase 3, and the phase 4. Before phase 0, you can see the blue line here. That is minus 90 millivolt. In other words, that is resting membrane potentials of our cardiac muscles. In this point, there will be no muscle contractions, in our cardiac muscle stay in the relaxation positions. Okay, after that, we'll move on to phase 0. Here is your phase 0s. What happened in the phase 0? Let's see with that photo. Here, in case of phase 2, there will be the rapid sodium influx. Okay, I will use different color. Here, there will be movement of sodium into our cardiac myocyte. So there will be a lot of positive ion here, here, right? So the action potential is moved upward and reach to 0 and then pass through it and plus 30. That's our phase 0. That means in case of phase 0, there will be rapid influx of sodium in our cardiac myocyte. You need to know that. Okay, and then move on to phase 1 and the phase 2. In case of phase 1 and the phase 2, there will be the influx of calcium channel. Here is your calcium channel. Let's imagine that. I draw with different color. Here's your calcium channels. It's also positive charges, right? But the difference is there is slow influx of calcium into our cardiac myocytes. Okay? Because of the slow influx of calcium, there will be phase 1 and also phase 2. But difference between phase 1 and 2 is, in case of phase 2, there will be some efflux of potassium. Right? Efflux means out of our cells. Okay? So there will be some positive charges were lost and then move on to downward, and then action potentials reach 0 millivolt. Okay, and then we move to phase 3. In case of phase 3, there is also potassium efflux. That means potassium out of the cells. Okay, so if positive charges move out of our cells, there will be the less electrical activities and then go down like that, and then we will reach our resting membrane potentials and then phase 4. That is our action potentials. So let's summarize that. In case of phase 0, there will be rapid sodium influx. Phase 1 and the 2, there will be slow calcium influx. And then phase 3, there will be potassium efflux and then our resting membrane potentials. Okay, that's a very basic physiology. We need to know that. That is our action potentials of cardiac muscle. Okay, so because of action potential in our cardiac muscles, there will be electrical activity. So how can we know that there is electrical activity in our cardiac muscles? So here is machines. That is very important in the formations of ECG. That's called the galvanometer. You can see that here is the resting point. In resting point, it will indicate 0. And the move to left, there will be more positive. Move to right, there will be more negative. Right? Okay, so this machine can detect electrical activity in our cardiac muscles, in our cardiac myocyte. Okay, here I want to explain 2 phases of cardiac muscles actions: depolarization, in other words, contraction of the cardiac muscles, and reporizations, that's the relaxations of the cardiac muscles. Okay, so let's start with depolarizations. I will draw some photo here. Here, that is your, let's imagine that that's your galvanometer. I'm not a good drawer. So if, because of my poor drawing, let me execute. Okay, here is clavinometer, right? And in the resting positions, there is 0, and move to left, positive, and move to right, there will be negative. Okay, so that's your cardiac muscles, and if we sections, and if we decide cardiac muscles like that, here is your negative pole, here is your positive pole. So to detect the electrical activities in the cardiac muscle, we will connect it to our galvanometer, right? One for the negative pole, one for the positive pole. Okay, so here it will stimulate our cardiac muscle contraction from that point, right? From that point, there will be action potential in this source. Let's imagine that there is our cardiac muscle, so 1, 2, 3, 4. Okay, it will stimulate cardiac muscle from that point. There will be action potential, right? And then if move to next cardiomyocyte, here, and then it will reach the positive pole of our cardiac myocytes. Okay, so here we need to know that some importance about maths and physics, that is our vector. Okay, so let me draw the vector arrow like that, because electrical activities move from here to here. Okay, so in this cardiac myocytes, there will be a lot of positive charges, and it would create positive vector. Okay, so if positive vector move to positive pole, and our galvanometer showed light that it will move to positive side. Okay, so here again, here is your galvanometer and attached to negative as well as positive pole. This time we stimulate our cardiac muscle from that point. Okay, so if there is importance of cardiac action potentials, there will be a lot of positive charges, and then in the vector also positive vectors, right? Positive, because of depolarization phase. You already know that in action potential cardiac muscles, if there is depolarization, there will be the more influx of the sodium, and then these are the positive cation, right? So this is positive vector. Okay, so this arrow carry the positive vectors and then move towards negative pole. So the galvanometer will show like that, move to negative. So we need to know the very basic principles to detect electrical activities in the cardiac myocyte. Okay, so simply I will explain this in a simple way. If positive vector move towards positive, there will be positive in galvanometer. If positive vector move away from positive pole, there will be negative in galvanometer. That's a very simple point. Okay, these two mention about the depolarization phase. Okay, as we know that after depolarizations, after cardiac muscle contractions, there will be relaxations, right? In other words, it's called repolarizations. Okay, so let's see that if Also we connect this pole to galvanometer and then clavinometer. In case of reporizations, positive charges move out of the source and it would go down to minus millivolt and resting memory action potentials. Okay, so there will be lot of negative 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 here negative, right? So move like that, 1 2 and then 3 and reach to negative pole. Okay, so here's what the difference is. Vector is negative vector. Here is your negative vector. This arrow carry negative vectors. If negative vectors move towards negative pole, and the galvanometer will show like that. So that's a very important point. So we don't need to confuse that, because according to vectors, if negative vector move toward negative, that is positive. If positive vector move toward positive, it is positive. If positive vector move towards negative pole, it is negative. That's very important point. Before we move on to next portions, okay, so that's all about repolarizations. So that's electrical activity we detect on our cardiac muscles with the machines called galvanometer. So let's see very practically. Here you see this is our cardiac muscles and this is our fourth chamber. Okay, this is our base. At the base there will be negative pole, and the apex there will be positive pole. Okay, so this is SA node, this is AV node, and then bender here is right bender, left bender. Also there will be some divisions like left anterior fascicles and left posterior fascicles. I will explain it about in the later slide. Okay, here electrical activity go down like that, right? SA node to AV node. That's a very basic principles. And then to AV node to bender here, and then right bender, left bender. Right? Okay. If there is electrical activity, move from SA node to AV node. What happened in this cardiac myocyte? Let's see that. If we stimulate from the SA node, right? SA node, there will be action potentials in the cardiac myocyte, right? Action potentials in our cardiac myocyte. That is muscle action potentials. There will be more positive ions in our source, and it would carry the positive vectors here. Positive vectors, positive vectors, positive vectors, positive vector. If positive vector move towards positive pole, there will be positive indicator in the galvanometer, right? Okay, so this is number 1. This is number 1. And then electrical activity reach the AV node. But AV node does not trigger directly downward to the ventricles. That's a very basic principle. You need to know that. If the electrical activity reach the AV nodes, what happened? There will be AV nodal delay. Okay, so what does it mean? AV nodal delay means if there is the venous return from the inferior vena cava and the superior vena cava reach the right atrium, and the right atrium contract blood into the right ventricles. But that is also the contraction time, right? Also, there will be relaxation times. To complete filling of the blood from the right atrium to the right ventricles, we need time, right? So, that is complete filling of right atrium to the right ventricles. There will be AV nodal delay. Okay, so if the electrical activities reach the AV node, that is also the anatomical importance here, fibrous annulence. Fibrous annulence means there will be no electrical activities here. So if electrical activity reach the AV nodes, action potential, no. There will be no action potentials. So galvanometer will show 0. Okay? Galvanometer will show 0. Here, your galvanometer will show positive. Here, your galvanometer will show 0. Okay, so let's move on this. After reaching the electrical activity to the AV nodes, will trigger slowly into the spandrel his and then move to right and the left. Here is your septum. In other words, it is interventricular septum. Interventricular septum also has same muscle thickness, so it's also necessary to contract. So here we need to know that in muscle of septum, and in other words, it is septal depolarizations, if move from left to right like that, not right to left. Okay, so this is septal depolarizations. In case of septal depolarizations, let's see with our vector. Okay, here this is our vector arrow. Because of depolarizations, there will be a lot of positive charges, positive charges, positive charges, positive charges, and the vector is positive vectors, right? So if we arrowhead directed towards where? Negative. This is positive vector. If positive vectors is moving away from the positive pole, and the galvanometer will show negative, right? Okay, so here is our galvanometer. Let's imagine that and move to negative. And we'll draw that electrical activity in the waveform later, right? Okay, after the septal depolarizations, what happened? And then there will be contractions of the whole myocardia, and then there will be basal myocardia contractions. Okay, after this is number 3. This is number 2. This is number 3. And we'll continue this 1, 2, 3, 4 in the ECG waveform. Okay. Okay. So let's see with our major myocardial contractions. So if there is muscle contractions in our myocardias, there will be a lot of positive charges, right? Positive charges, positive charges. Here also positive charges, positive charges. So if there will be the positive charges, and then depolarization arrow move like that, positive vectors carry the positive charges and move to positive pole. So what happened? Here is your galvanometer. it will indicate positive, right? Okay. After that, here is the number 4. Okay. After contractions of the whole myocardia, we don't need to remember that there is also contractions of some basal myocardia, like that. An arrow is moved upward. Okay, so if we draw some vectors here, because of depolarizations, there will be negative. There will be positive factors, right? There will be positive factor move towards to negative pole. What happened? Clavinometer will show negative. Okay, this is our number 5. So this is all about depolarizations of our cardiac muscles. After depolarizations, what happened next? Reporizations. Okay, let's see again. That is our cardiac muscle. This is our cardiac myocyte. In case of repolarizations, we need to know that its direction is from outward to inward. Outward to inward. Arrow like that. Outward to inward. So here is your negative pole. Here is your positive pole, right? Okay. In case of repolarizations, here's your repolarization phase. There will be lot of negative ion, right? Because depolarizations leads to increased influx of sodium in the cells, and then it will carry the lot of positive ions and then positive charges. In case of repolarizations, positive charges move out and then reach the minus 90 millivolt, right? Okay, here is your negative ion. So let me draw some vectors here. Arrows like that, and this arrow carry the negative vector, right? Negative vectors. If negative vectors move towards negative, what will happen? It's very simple. Clavinometer will show, positive, right? Okay, so here is your number 3, 4, 6. Okay, so this is all about the phases of depolarizations and the repolarizations we detect on galvanometer according to vectors. Okay, so let's we move on to the last portion of waveform formations, that is our pqrst wave. Okay, so here is your galvanometer. This is 0 positions. This is positive. This is negative. Right? Okay. If we draw the waveform according to the electrical activities in the cardiac muscles. Okay. So let's see that. In the fats, in number 1, right? In number 1, That is, positive vectors carry the electrical activities towards positive. So galvanometer will move. This is your resting, right? If carry positive vectors to the positive pole, that is positive, right? So galvanometer move to here. Okay, and then electrical activity will reach the AV node. What happened? Galvanometer will show 0. So there will be no electrical activities here. That is your resting membrane action potentials, right? Okay, and then move to number 3. Here is your positive vectors move to negative. What happens? There will be movement of arrow towards negative, right? So like that. Okay, and then that is major myocardial contractions. Number 4, there will be the lot of positive charges move towards positive pole. Also, you notice that this arrow is the longest arrows, right? Because in here, in the myocardium or the ventricles, there is more muscle thickness than the atrias. So there will be more electrical activities and there will be more actions, potentials, and there will be more positive, right? Because of muscle thickness. Okay. And then we'll move to number 5. Here is your positive vector. Move towards negative. So what happened? It will be negative, right? Your clavinometer will move to negative. Okay. After number 5, we'll move to number 6. Okay. Here is your repolarization phase. Let's see that there is negative vectors, right? Moving toward to negative base. What happened? There will be positive, right? There will be positive. Here, there will be positive. So, if arrow move upward, and then resting potentials. Okay, so here, let me label this as P wave, Q wave, R wave, S wave, and then T wave. Very simple, right? So this is the formations of waveforms in the ECG. Why P? P means atrial contractions, right? What is QRS? It is ventricular contractions, right? Why that is T? That is ventricular relaxations. Okay, so why there is PR interval? Here, that means AV nodal delay. Also, there is QT interval, right? QT interval. And here is your QRS complex. That's it. That is your ECG waveform. PQRST, and then PR interval, QT interval. Here is PR interval, QT interval, and the QS complex, right? Okay, so now you will know the importance of waveform formations in the ECGs, and you will know the electrical activities and also the action potentials. That's very important point. We need to understand the physiology of the cardiac muscle action potentials, right? So if we know these very basics of ECG, well, if we move on to next advanced level like arrhythmias management, like myocardial infarctions, and it will be more and more easy. So let's see in the next video. If you liked this video, please click the like button and subscribe my channel and get the notifications. It is more for me. And let's see in the next video. Thank you.